News for your health tonight. Chronic pain can be life-changing. Some people never get effective treatment because they're not diagnosed properly. But now one local physical therapist says he's using some unconventional methods to offer new hope to those who are suffering.
It hurt when I was driving. It would hurt moving my leg from the brake to the accelerator. It would hurt sometimes putting my clothes on, just doing the normal activities of life.
A year ago, Janice Kaplan was suffering from chronic pain. She saw dozens of doctors and nobody could give her a clear diagnosis or any effective treatment. Then she went to see a physical therapist in Bethesda, Dommerholt. He ordered some tests and found something that no MD had ever mentioned to Janice. The level of iron and vitamin D in her system were both in the normal range, but both on the very low end. And Dommerholt told Janice he believed that was causing her pain. She started taking supplements.
Within 2 to 3 months, I felt 100% better.
Really?
It was that easy. But it really took a detective to figure that out.
Most of our patients have been seen by others, usually for pain problems. It could be back pain, neck pain, headaches, any kind of pain problems. In spite of care by other providers, they still have pain and they're looking for different answers.
Dommerholt says up to 90% of the chronic pain patients who come into his practice have been or undiagnosed by other physicians and therapists. He suspects it's because they're not looking into what's causing the pain. Instead, he says they're diagnosing based on the symptoms.
Sometimes it has to do with a lack of thorough diagnostics, that certain things are overlooked that people may have or may not have, and they're not always investigated.
Jan Dommerholt also uses some unconventional treatments. For example, dry needling, a technique similar to acupuncture. A small needle is inserted into a muscle's trigger point. He says pricking this trigger point relaxes the muscle and relieves the pain. Timothy Taylor says that technique helped him get over his chronic pain after more than 3 years of suffering.
I was at the verge of disability. The doctors I went to made a variety of diagnoses. Some called it tendinitis, bursitis, fibromyalgia.
Dommerholt eventually diagnosed Taylor with myofascial muscle pain. After 8 weeks of dry needling and injections of compounds like Botox, Taylor says he's now 95% pain-free.
It is essentially being reborn. I was a man in ruins, a man nearly beaten, nearly disabled by pain, and now I feel fully able to do everything that a man of my age needs to do.
To learn more about chronic pain and Jan Dommerholt's practice, we've put a link on our website, NBC4.com.